Did the government misread your plea?
Yeah, mukha kasing naguluhan ang gobyerno natin, ano, dahil sa there is another group who actually sent also a message to the president composed of a few number of doctors and nurses. And sila itong marami silang mga complaints and also sila itong merong mga hinihingi na marami silang mga hinihingi, no? And I think that also includes the incentives that you mentioned earlier on. And also yung ouster of certain persons, no?
Yes, yes.
In particular si Secretary Duque. We really don't we did not request for any of this. And if you probably saw our letter, if you read our letter, we did not make any complaints at all, but we are actually trying to tell giving out recommendations on how we can better improve the controls that we have right now as far as the spread of infection is concerned. We are one with the government, we are one with the president in this fight, and we believe that we cannot be doing this all on our own. The government cannot do this all on their own. We have to be unified, no, in this fight against COVID-19.
Yeah, you were.
Yeah. Tinatanong lang namin because you're asking for a recalibration of the response. Ano po ba yung mga suggestions niya to recalibrate? What are you hoping to see within these 2 weeks? Mga viable that the government can do?
First, no, yung ma-put into place talaga yung more specific and more detailed way of doing the contact tracing. So very important yan, no, contact tracing, because if you are not able to follow up the people who were exposed to a COVID-19 patients, then you will not be able to identify them and isolate them, no, or put them on quarantine. So pag hindi natin ito nagawa, then we will have failures, because this will also cause continuing spread of the infection. And then the second one is really be able to have the more effective way of identifying patients who have COVID-19, no? So case finding ang isang malaking problema rin. And one reason why we are not able to do this more correctly is because of the persistence of some of our local government units in the test that they make use of in determining whether a patient has COVID-19 or not. So most of the time, napansin naman natin, no, there is too much reliance on the rapid antibody test. Yes, and oftentimes in the past we have already told them that it is not reliable, no? At the most, ang sensitivity niya is only about 50%. So people should understand, pag sinabi namin 50%, it is like, tossing a coin, no? 50-50 chance.
Yes, ma'am.
Malalaman mo.
That's yes or no lang eh. So parang hula lang. Pag ganun, parang hula lang talaga. Kasi yes or no na naman, that's already 50%.
Yes, right. So, pag sinabing 50%, ang ibig sabihin niyan is a useless test, no?
Right.
So, we're actually putting resources to something that is not, that will
reliable,
not be helpful, no? So, still, ang diagnosis natin will be dependent on the PCR, no, yung swab test. But there is a very promising test that we can actually look into, and we discussed this already with the Department of Health earlier this afternoon. And yan yung rapid antigen test, no, which is yes, the antigen, hindi antibody, no. This promises to be a more reliable test over the rapid antibody test. But of course, it still needs a little bit, we still need to really see kung yung magiging results ng mga nakikita namin. Pero so far mukhang mas maganda siya, no, compared to the rapid antibody test. And And that is actually what we have also discussed already with the Department of Health. As far as testing is concerned, we are one naman with the Department of Health, no? Nagkakaintindihan kami nila Secretary Duque and the people of the DOH. So, yun nga lang, pagdating sa implementation kasi yun ang nagiging problema natin because dependent actually doon sa LGUs, yung implementation ng mga test na ito.
Doktora, loud and clear po yung message sa public and in fact consistent from the very start. At the same
Yes.
time, you said kanina, if we appreciate kanina correctly, that this timeout is really about government having the time to recalibrate and reconsider the, In the meantime, there's still the matter of the exhaustion of our frontliners. Ano po yung options ngayon ng frontliners, ng doctors, ng hospital to give some relief, given that we've been hearing reports of people resigning, nurses not wanting to sign up? What options are available to our frontliners and to our medical institutions to provide some relief and to improve the working conditions for you, at least for the next 2 weeks?
The most important really, Robbie, is to prevent the spread of infection because it is only through that we will be able to relieve also the bulk of work that we are seeing right now. No? But in the meantime, as you said, no, it is probably best to be able to mobilize the existing and current health workforce that we have. Department of Health definitely has the doctors and the nurses that are available within their department. So these people can actually be mobilized and sent here probably in the National Capital Region. Of course, that is provided that their area where they are staying right now is not burdened also with so many COVID-19 patients. Pero again, if we look at the totality of the country, it is really the main burden of COVID-19 is seen and experienced here in the National Capital Region.
Yes.
Some nearby provinces like Laguna, Bulacan, and also Cebu, some in Iloilo. So, hindi naman lahat ng buong bansa ay experiencing this problem. So, the Department of Health can probably mobilize some of its people
Yes.
to go to some areas, to beef up the health workforce.
Yes, they're talking about bringing in substitute health workers, no? And they're also looking to hire an additional 10 to 20,000. Do you think that's sufficient? Also giving cash aid, risk allowances, are these helpful?
Maybe, yeah. But for our group, we're not really looking too much into the incentives. I think that that recommendation is coming from another group, but it will help, especially in hiring the needed additional workforce here in Metro Manila. So the incentives that the government has, the Department of Health has in mind will help in being able to achieve the objective of adding up to the health workforce in NCR.
Ma'am, how did we get to this point? How would you assess the communication protocols and communication mechanisms between the medical associations and government and IATF in particular?
We have had some of our colleagues who are also part of the advisory committee of the Department of Health. But I believe that it is very important that probably the ears of the medical community will or the ears of the leaders of the country, in particular the president and the other members of the IATF, will will actually hear the voice of the medical community, because sometimes hindi rin nabibigyan ng yun lang namin, no, maaaring hindi nabibigyan ng
Hindi, pero yun nga po, ma'am, if you don't mind, I guess that's my question. Put beyond tingin, ano po ba yung sistema? How often are you consulted? Is there a regular meeting prior to the developments this week? And paano po ba yung sistema for coordinating with the medical community prior to this weekend?
Not so regular, I would say, no. Then that is the reason why we ourselves do not know exactly kung saan nanggagaling yung mga ibang ginagawa, lalo na sa LGU, no. So we're really talking about the LGUs, no. So probably that is one aspect where improvements are needed, no. The communication probably from the top level of the interagency of the IATF and the DOH to the LGUs. Baka kasi hindi din masyadong very clear, no, kung ano yung dapat na gawin sa mga LGUs.